So here is your station and here is your question.
Okay, I'm ready.
Okay, so if you've read and understood considering it communication skills station, please begin.
Okay. Hello, I am Dr. Rana, one of the surgical doctor here. Hello, Mr. Ahmed.
I am David Brown. I am 59.
Okay, hello, Mr. David. I'm here today to ask you I am here today for inform you and what we will do for you, the procedure we will do for you. Can I ask you, do you know how you do know what we will going to do?
Yeah. I met my GP. He said to me he will do something in my food pipe because I have difficulty in swallowing last 2 months. But I don't know what he will do. He will do open or what? I don't know. Just please explain to me.
Okay, I will explain to you. Today we are going to do esophageal gastroduodenoscopy. That we call it OGD. That is a small camera. We call it endoscope. We will insert it you in your mouth down to your food pipe.
You
Then
can draw here and show them
okay,
whiteboard. Yes.
okay.
You can draw and show whatever you're telling your patient.
Okay. I will try.
You have the access to pen here?
Okay.
Yes.
Okay. We will insert the small camera. We call it endoscope to your mouth, like here,
Okay.
and
Okay.
down to your food pipe, like this.
Okay.
Down to your stomach and upper part of your bowel, small bowel.
Okay.
That make us to see what going in your food pipe, and we can also take tissue from your food pipe, and we can widening the narrow part that we show it in barium swallowing.
Okay, Dr. Rona, but I read, I see in YouTube there is a risk. Sometimes it injure my food pipe, and I am afraid from this one.
Okay, there is
What's
no
what's the risk of this procedure?
Okay, there is no procedure without risk factors. But so I will tell you some risk factor can open. Maybe damage your teeth when inserting the camera. Infection maybe like chest infection, bleeding
Mm-hmm.
of side of the
Mm.
tissue. The most serious risk cutting your food pipe, and
Oh,
that need
I am
surgical.
afraid from this one.
I understand that. I appreciate your fearing. But listening for this risk factor is not sure that not essential. It may be happen, and you will know you'll be in good hands and skilled doctors. You made
Okay,
your
how I know if there is a cutting in my food pipe?
what
How I can know if there is a cutting in my food pipe?
after procedure.
Yeah.
During procedure.
During
Pain.
procedure, the
Pain.
the doctor pain. You will be severe pain.
Yes. Good.
Okay. Dr. Rona. Uh, in that case, I don't want to do this procedure. I'm very scared.
This
It's very risky.
No, it's not very risky. You will be an under skilled and experienced surgeon.
Very
That's
good.
only way to know what's happening in your food pipe.
Look,
And
the saliva is coming out of my mouth. You know, It's very
okay.
difficult for me.
Sorry for that. Do you need some tissues?
Yes, please.
Okay, take it.
Okay.
Because
Uh,
for narrowing, the most probably cause is the narrowing in your food pipe that make your saliva doesn't uh, down for to your stomach, so that's going out your mouth.
okay. Can you tell me, is it a cancer?
Okay, it's still early to confirm that. The only way we can confirm that after taking some tissue from your food pipe and examine it and do some tests for it.
Good.
Okay. Can you tell me is the when the result will appear?
It takes 2 weeks to appear, and we will inform you when this appear. We will contact
Okay.
you.
Okay. Can you tell me? Okay. When I can go home?
After you return your all recovery and your GP decide to your doctor your GP no, your surgical surgery uh, examine you and tell that you can go out.
It means in the same day of this procedure.
uh, مش
You want
عارف.
to look
I
at the
don't know.
stem
Okay.
again?
Okay.
What?
I will.
You want to look at the stem again?
Okay.
Okay.
Okay,
Mhm.
please tell what measures patient should do before
W- w-
the procedure.
when I should start my fasting.
What?
When I should fast. I should fast, right?
Yes.
How many hours I should be fast for this
6
procedure?
hours before procedure.
Okay. What food I should take after this procedure? I can eat after this procedure.
You can take fluid and soft food after 2 hours after procedure.
Okay. After okay. But I live alone. How can I go to my home?
Mm, no, I don't know.
Okay. Okay. But I don't need the GA, general anesthesia. I am afraid from this one.
Mm, mm,
Is
mm.
there any other way you can offer this?
Is there any other way to make a procedure without general anesthesia?
You can take local anesthesia.
Yeah,
You
good.
can take local anesthesia.
Spray, good.
Okay.
You are not feeling any pain.
Okay, thank you, Dr. Rana, for your explanation.
Okay.
Yes. And
If you don't need any ask, I am here to
Yes.
answer you.
check patient's understanding at the end and then make the patient sign the consent form.
Okay.
Okay?
What?
Okay. Check patient's understanding. Whatever you have explained, the counseling, make patient tell you everything you have explained it to the patient. And then at the end, ask the patient to sign the consent form.
Okay.
Right?
Okay.
And then also patient will ask you if there is any other alternative you can do instead of doing, because when you were telling about the food pipe, patient will get afraid and would say, is there any other alternative you can do? I'm really afraid of this procedure.
Okay, what I
So
can...
what is the alternative you can offer?
What?
Barium swallow has already been done, right? But
Yes.
you'll say that has already been done, the only alternative which was possible. But the drawback with that was that you couldn't dilate your lower end of the food pipe with that, and it was not possible for you to take the biopsy or the sample from the food pipe during that procedure. So unfortunately, this is the only procedure you can offer.
Yeah, OGD, yeah?
Yes, please, OGD.
Okay.
And when you're advising about the food, what to eat and what not to eat, then you have to especially say do not or avoid hot drinks and alcohol after procedure.
How many hours?
Patient is not allowed to drive back home alone because patient told you, I'm living alone home. So you'll say bring someone with you because you're not allowed to drive back home alone. So if patient says I'm living alone, then you can say
You should have company
yes,
to not drive alone.
Yes, if there's no company, then you can say, all right, you let the staff know, nursing staff, they'll arrange the taxi for the patient. If examiner asks you if it is okay or if it is safe for the patient to travel back home in train, public train, what would be your answer?
No, it's not safe.
Not safe. Very good. Excellent. You know it. Good.
How I do it?